Weber here from Registry Ready TV, here for another session of Test Breakdown, where we break down National Registry style test questions to give you the answers, but not just what the answer is, but why, because that's what matters. So let's work our way through 4 quick questions at the BLS level to give you a little bit of a background as to why the answer is the answer, and how to come to the correct answer when you get in for that test, and how to avoid some of the pitfalls. So let's do it. Question number 1 that we want to work through today, right? Your medical patient awoke with isolated abdominal pain, right? Which of the following is contraindicated in your treatment plan? Now, let's break down the question a little further. Medical patient with isolated abdominal pain. What does isolated mean? That means just abdominal pain. Like that's it. That's the only problem you have, just abdominal pain, right? Which of the following is contraindicated in the treatment plan? Now, this requires you to understand what the word contraindicated means, right? That is going to be a vocab word. That's going to be something that you have to understand because it's so important in a lot of different parts of medicine, especially pharmacology, but even this, where we have to understand the contraindicated means not indicated, right? Not indicated. And where the most common breakdown in this particular question is simply going to be people misinterpreting or misreading the word contraindicated, right? So let's break down the options. Administering oxygen, providing backboarding for the patient, providing prompt transport, and covering the patient with a blanket, right? So what's contraindicated for this patient? Well, administering oxygen for a person with isolated abdominal pain certainly isn't contraindicated. Matter of fact, in a lot of different circumstances, depending on the patient's vital signs, it's certainly going to be indicated, right? So that's not one of the answers, right? How about providing prompt transport, right? Providing prompt transport. Is that appropriate for a person having an isolated abdominal pain? Certainly, especially when you consider what the potentials could be of isolated abdominal pain, right? So providing prompt transport, that's definitely indicated for these types of patients. So what do we got left? Covering with a patient with a blanket. Is covering a patient with a blanket ever really contraindicated? I mean, unless the person's having a heat stroke or a heat emergency of some kind, maybe heat exhaustion even, it's pretty rare, it's pretty unusual that covering the patient with a blanket would ever be contraindicated. So that's really not an option either. Now, conversely, is backboarding a patient contraindicated? Sure. What do we backboard people for? Patients having some sort of neck and back problem or a suspicion for spinal trauma, right? In this circumstance, because of the word isolated meaning just the abdomen, that's really what makes backboarding contraindicated. Good. If you came up with that answer, that's awesome. Nice work. Let's go to the next question. So, identify the true statement regarding anatomy of a pediatric patient versus an adult, right? A, an adult's airway occludes easier than a child's does. The ribs of a child are considered more rigid. A child's windpipe is considered is often more soft and flexible. And D, an adult's pupils react faster to light and darkness. Right, a couple of different ones in which we can delete pretty quickly because again we're looking for the true statement in the options. An adult's airway does not occlude easier than a child's does. Mostly because of its size, right? So we don't really have an issue with this. The ribs of a child certainly aren't considered more rigid, right? If anything, it would be considered less rigid because children, especially our youngest children, are still developing. So it's certainly not an issue with rigidity, okay? And when it comes to option D, an adult's pupils react faster to light and darkness. There's just no truth to that, right? There's no science that supports that. Pupil is a pupil is a pupil when it comes to reaction to indications of light, right? The only true answer to this is going to be children's windpipes. Now, you probably saw a reference to this in the pediatric CPR section of your program, where it was indicated that for a pediatric patient, an infant to 1-2 years of age, it might be a good idea, it's actually always a good idea, to make sure we don't tilt the head back too terribly far, right? Because if you tilt the head back too terribly far, because of the size and the flexibility and the softness of a child's airway, it's not hard actually to kink off that airway if we lean the child's head too terribly far back, right? So too far back and too far forward for a child, bad idea from an airway perspective, right? And it has a lot to do with the fact that a child's windpipes are more soft and more flexible. All right, so let's talk about question C, right? You just position a patient complaining of chest pain on the EMS stretcher. The patient will most likely prefer which position for transport, right? And it gives you 4 different options of 4 different types of positions. So what it's trying to gather from you is there a specific position that's appropriate for a patient experiencing chest pain? And if it isn't, which position do most patients prefer, right? So the answer is absolutely going to be semi-Fowler's, right? Semi-Fowler's is, it's considered a position of comfort, right? Because for a patient having chest pain, cardiac-based chest pain especially, these types of patients don't really have a specific patient or specific body position that's better for them, right? So it's not the shock position, it's not freestanding, sitting up all the way because they're having breathing troubles. That semi-Fowler's is going to be the position that's considered the position of comfort, making it the best for a patient just experiencing chest pain only. Now again, if they're having shortness of breath, and they're having a difficult time catching their breath, maybe a full Fowler's sitting all the way up might be remarkably better than a semi-Fowler's position. Okay, so let's break down our next question. Which of the following terms is used to describe body parts found on the same or either side of the midline? Body parts or organs that are considered to be on the same side of the midline are said to be bilateral, right? Some examples: lungs, femurs, tibias, where you have it on both sides of the midline, right? That's considered bilateral. Medial would only describe parts found in the middle of the body. Lateral refers to the side. Central would be at the body core. And ipsilateral means one side. Ipsilateral, right? That goes back to the directional portion of your book. Go back and make sure that you review those kinds of directional terms, because I'll tell you, that's straight vocab. If you don't know what each one of those words means, it's going to be very difficult to break down these questions. This is one of those low-level National Registry questions that leans deeper on a knowledge of vocab than an understanding of how to actually break a question down. That's it. That's what we have for you today. Hopefully that was helpful in starting to break down National Registry style questions and getting an understanding of some of the strategies that you can use in order to break down these questions and come up effectively with a good answer. Like always, thanks for being awesome. We appreciate your time, we appreciate your patience, we appreciate your energy, and like always, we look forward to seeing you in our next episode. Have a great day.